Hi, everyone, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Chris Hudspeth. I'm the radio program manager for MS Focus Radio, and I'm joined today by Dr. Ben Thrower, who'll be talking to us about the new world of telehealth. And after the presentation, we'll open it up to your questions and comments. Dr. Thrower, if you don't know, is the medical director of the MS Institute at Shepherd Center in Atlanta, Georgia, where he works exclusively with individuals with MS. And before joining Shepherd, Dr. Thrower was the medical director at Holy Family MS Institute in Spokane, Washington. He's fully committed to quality care of the MS community, and Dr. Thrower was the first physician to be inducted to the NMSS Volunteer Hall of Fame, and he serves as clinical instructor of neurology at Emory University, and he is our medical advisor for MS Focus. We're pleased to have him join us today to present this very important and timely topic. Dr. Thrower, thank you so much for joining us, and I'll turn it over to you.
Great. Thank you so much, Chris, and thanks to all of the other staff at MS Focus. We so much appreciate everything that you guys do. I think the work that you folks do is especially important right now during the COVID pandemic and the fact that everyone is living in a very different world and we're all looking for some sense of normalcy. The COVID pandemic has changed our lives in a lot of different ways, and one of those ways has been in how we interact with people with MS, or maybe you're a family practice doctor, how you see your patients, or just really anything in healthcare has been impacted. I think a lot of healthcare services were right on the cusp of being delivered by telehealth, telemedicine, and we're ready to embrace it. And really what the COVID pandemic has done is it just accelerated that sort of involvement with telehealth at warp speed. So most medical practices really for almost survival purposes really had to jump on board with telehealth. There are a lot of different platforms and commercial entities out there who offer telehealth, but the basic idea is it's going to be some combination of audio and video. There are legal aspects to telehealth. One of the questions that has come up sometimes is why can't we just do a telephone visit? And there are two parts to that. There's an insurance company part to why a telephone visit is not the same thing as an audio visual visit. They don't reimburse the same, unfortunately. I wish that was never a part of medical care, but the simple fact is it is. And so if we see someone in a telehealth visit with audio and visual capability, that counts as a regular doctor's office visit as far as insurance companies are concerned. If we spent 30 minutes on the phone without that video component, the insurance company doesn't consider that to be the same sort of visit. So there is that aspect. There are also legal implications in terms of refilling medications. If a person with MS is on a Schedule II medicine, so that would be any of your stimulant drugs, so your Adderall, Ritalin type medications, any sort of opioid painkiller, the DEA actually requires that there be a video component to the visit. We legally cannot prescribe refills on those medications or an initial prescription on those medications unless we have the video component to it. And I think the thinking there is that it's a safeguard, that we're sort of identifying that person, that we're looking them eye to eye on the video screen, that we know that who we're actually talking to. So we are primarily at our MS center, we are primarily using telehealth for follow-up visits. Initially in the COVID pandemic, we were seeing new individuals. We're trying to keep that to a minimum, and if possible, get new individuals in person, at least for that initial visit, because really you'd like to be able to do a good physical exam. There are outcomes that we are collecting for individuals with MS, things like a timed 25-foot walk and 9-hole peg test that you really, it's more difficult to do that in a remote setting by audiovisual means. So at least for the initial visits, we're trying to see individuals in person. But after that, we are using quite a bit of telehealth. So in most MS institutes or centers, we have a variety of different services that people with MS would access. So some people are on IV medications, natalizumab and ocrelizumab, and other medications. Obviously, those individuals are going to still be coming in likely to the MS Institute or another infusion center. Some people are coming in and getting MRIs. Some people are having laboratory studies drawn. But if a person isn't having one of those things done that would require, hands-on, in-person visitation, though any visit that doesn't require that really is I think a perfect example of where we could use telehealth. So where we're just trying to touch bases with a person, maybe we started a new medication and we just want to find out how the person's doing. Those sort of visits, I think, are perfect for telehealth. We have done internal surveys to see what do people with MS think of this brave new world. And before we came onto this, Casey and I were speaking from MS Focus, saying, our thought was that most people would love it, that if it saves them a visit, they're not out in traffic, they're not having to worry about potential COVID exposure, that people would just love this. Most have in our experience, but not everybody. So actually in the survey that we did, what we found, it was about a 50-50 split, that about 50% of individuals said they preferred the telehealth visit, and 50% said no, they really would have preferred to be seen in person. And we've not broken that down to see, what are the differences between those two groups, but I would suspect if someone doesn't care for telehealth, it may be that they really like the interaction with their healthcare team. It may be that that if they were, say, on an infusion, maybe being back in the infusion room with the same group of individuals with MS every infusion is a sense of camaraderie and socialization that you just don't get through a telephone video visit. It may be that people just want to get out of the house. We do see people suffering some emotionally from being locked down. And I think just getting out of the house and doing something is a benefit for some individuals. When you think about doing your telehealth visit, for anyone on the line who's not done one before, typically what that's going to look like is your healthcare provider is going to send you typically an email link that's going to have that you'll click on at the given time. You'll be sitting there, and then your healthcare provider is going to pop onto the screen. What's helpful for us is if you could treat that as a regular doctor's visit. So have your questions, your thoughts, your concerns lined up. It's probably helpful to have your medications right there in front of you, or at least a list of your medications, so that we can run through those and make sure that everyone's on the same page. We can deal with any refills that might be needed at that time. It's helpful just from a video quality standpoint if you cannot have a window behind you, just because it gives some funny lighting. It's also helpful with most of these telehealth platforms if you will shut down any apps that you might have running in the background. So if there's any other windows that you have open, try to close those. Once you're up and running, probably go ahead and shut off your email application. A lot of us have little alarms that ding when we get a new email, so that can be distracting to you if those alarms are going off during your telehealth visit. If you're having problems, and this is something we've learned, I would say that 95% of our telehealth visits have been gone off without any technical difficulties. Every now and then we'll have a situation where either the person on the other end can't hear us or we can't hear them. I think it helps to have a big white piece of paper with something to write on, like a Sharpie, something that's dark. That we've actually used that. We go old school and say, hold up a sign and say, can't hear you, just so because, or point to your ears to let someone know that you can't hear the other person. when you set up your telehealth visits, you may get a phone call from your doctor's office the morning of or the day ahead of, just prepping you for that telehealth visit. Get the phone number for whoever that the person is at that doctor's office that's running those telehealth visits. That way, if you have a technical problem, it's time for your appointment and you can't log on, or you log in and the doctor's not there after a certain length of time, or you can't hear each other, you can call that person on the other end of the line to let them know that you're having difficulties. We've had that come up a few times, and there have been situations where we've had to either reschedule those telehealth visits or convert them over to just a telephone call only, if that's within the legal bounds, if there's not something that we needed to do that required that video component to the visit. I don't think that telehealth is going away. I think that even after the COVID pandemic has quieted down, I think that we have crossed a bridge that we probably won't return in the other direction. I think that what we're going to find is that some insurance carriers probably are in favor of telehealth. If you think about the way some MS institutes and centers work, for some of our MS programs, there is actually what we call a facility fee. So when you go in to see your healthcare provider, you have your charge for your doctor's visit or your MRI, but there may also be a charge simply for walking in that building. And that obviously goes away if you're doing things by telehealth. So there could be a cost savings sometimes to doing things via telehealth. So I think that's going to be appealing to insurance companies to keep that around. Another area that we're seeing explored is the idea of telerehabilitation. So, a big part of MS care involves this idea of a comprehensive integrated team where we've got physical therapists and occupational therapists and speech language pathologists. So can we do some of that remotely as well? And the answer is yes. Some of those therapy services lend themselves better to remote care than others. For instance, physical therapy may be a little bit more hands-on, but maybe after the physical therapist sees an individual, a few times and has a plan up and running, maybe they could monitor progress remotely. So I think that's an area that we may see more and more of. One of the branches of therapy that probably lends itself very well to remote services would be speech language pathology, where we're focusing on cognitive rehabilitation. A lot of what a speech language pathologist does in cognition probably could be done remotely. So I would say stay tuned. We're certainly seeing some of that. One of the other areas that isn't specifically telehealth, kind of is, but it is still something we're thinking of remotely, is trying to keep people with MS in as good of shape as possible physically. A lot of our exercise routines have been thrown off by the COVID pandemic. People maybe aren't able to get to the yoga class that they used to go to or to a gymnasium. And we want people to be aware that there are a lot of online exercise programs out there. One of my favorites is My MS Gym. It's a great program. You've got trainers online who are very knowledgeable in working with MS. So take advantage of some of those online exercise programs. We don't want to lose ground in terms of people's wellness routine during this COVID pandemic. Lastly, in terms of what we can do remotely, I would just mention the counseling piece. This is a stressful time for a lot of people. People are not able to see their friends and their relatives, grandkids, in maybe ways that they are used to, and it's very stressful for individuals. So counseling is something I think that really lends itself very well to telehealth, and you're trying to keep people's moods so where they need to be. So I think that those are the things that I'm seeing in the world of telehealth and telemedicine. I think, Chris, what we'll do is let's kick it open to some of the listeners and see see if people have thoughts or questions, challenges that they've had in this telehealth world.
Yeah, absolutely. So if you do have a question or a comment, please make sure to use the raise your hand feature in the app, or you can send your question via chat. If you would like to raise your hand, you can click the screen to pull up the menu, select more, it's the icon with the 3 dots, and then click raise hand, and I'll unmute you. Then a button will appear on your screen and asking if you want to allow me to do that, and then you just select allow. So we do have a question from someone, and the question is from Casey. What are the implications of telehealth for people whose doctor is across state lines? Is it the same as in person?
Yeah, great question. So legally, you are allowed to see patients across state lines. So even though I'm licensed in Georgia, if my patient is in Alabama and is sitting in their living room in Alabama, that is perfectly legal. There used to be some funny requirements with telehealth that the patient actually had to go to another doctor's office. Here in Georgia, we went through that years ago, where the patient was required to go and sit in an exam room at another doctor's office. That is not true, and kind of defeats the whole purpose of telehealth in this COVID pandemic. We're trying to keep people as safe as possible. So you can do it across state lines, and obviously the person's going to be sitting in their own home.
All right, so if anyone, we do have a question coming in from Lisa. Lisa, I'm going to unmute you, and then just allow me to do that. And go ahead and ask your question, Lisa.
Okay, multiple times Dr. Thrower has mentioned My MS Gym. When I look up My MS Gym, all I can find is the MS Gym with Trevor Wicken.
Check that out.
So I could be me, garbage in, garbage out. But I'm really trying to find that.
Yeah, let me check that. I'm going to look it up right now because I'm hoping they didn't go away.
Well, and also some of these online things cost money. You have to pay.
Yes, and my MS Gym, unfortunately, I want to say the last time I looked, it was about $30 a month.
Which is better than not being healthy, but a lot of us aren't working like me now.
Yes,
I'm a substitute teacher, and I don't really want to be around.
So you are correct. They've changed their name to the MS Gym. Interesting.
But it is the same one with
It is the same one. Yeah.
Okay, well, he's interesting. I've watched a little bit of what he's done on, but you can watch some of it for free on YouTube.
Yeah, he does have some free content. The other one, let me see if I can find here real quick, is called MS Workouts. And I don't know if you've looked at that one. I know that both sites were offering some free content early on into the COVID pandemic. I don't know what they're doing right now. And then the National MS Society does have some free content for exercise at home as well. Depending upon your level of ability, I'm a big proponent of yoga for balance and core strengthening. I know that there have been some free yoga DVDs available on the National MS Society website. Let's see what we've got here. Yeah, the MS Workout, if you just punch that in, it unfortunately it pulls up a lot of different sites that have MS Workouts. So there is a site called MS Workouts specifically. So yeah, the cost issue is obviously, I wish it wasn't there. So I think though, if you look around enough, I bet you can find other free content out there.
Casey just sent a message that Megan Weigel, I believe,
yeah, right.
Has a MS organization, offers free online yoga.
Awesome.
Yeah.
Very good.
Could you spell her last name?
WEIGEL.
Can they, Chris and Casey, can people access that link through the MS Focus website, or do they need to go directly to Megan's site?
1 second. Can't hear you, Casey, if you're, 1 second.
They can go directly to Megan's site, which I will give right now. It is omsyoga.org. So again, that was omsyoga.org.
See, I think that charges also, because I looked at that, because I heard her one time. She was very interesting. I'm sorry to monopolize. I'm going to get off now.
No, that's great, because I'm looking also.
Since the pandemic, she has been doing free virtual classes. As far as I know, that's still going on. And if not, then shoot an email to one of us at the foundation, and we will provide you with some other resources. For example, Chris, who is that lovely lady on YouTube, Stacy
Durick. She does chair yoga and has a lot of free content. It is yoga. I'll find it. Yoga for everyone.
Sunlight yoga.
Sunlight chair yoga. That's it. And so she has a lot of free content on her website as well.
Yeah. So if you need help finding any of those exercise resources, you can reply to your registration email for this event, and we will get that information out to you.
Lisa, are you aware of another resource called Can Do MS?
I might have in an earlier life, but have forgotten it because there's so much out there right now. And you know, I'm leader of our MS group in Warner Robins, so I try to absorb as much as I can to pass on to the group. But
Can Do MS. So just Google Can Do MS. So traditionally Can Do MS. They are very focused on wellness and exercise in multiple sclerosis. They traditionally do live programs. They have some shorter weekend programs called Jump Starts. They have a 4-day intensive program, but they have shifted a lot of their work now to virtual, and they are definitely free.
thank you.
Yeah.
Thank you so much, Lisa. We do have one more question, but before that, if you do have a question and you would like to ask it, you can ask via chat, or you can raise your hand. Just click the screen to pull up the menu, select more, it's the icon with 3 buttons, and click raise your hand. I'll unmute you, then a button will appear on your screen asking if you want to allow me to do that, and then select allow. Evelyn, let me see, Evelyn's message is, it's from chat. No cell phone, no laptop, only have landline and desktop. My MS specialist is not taking in-person visits. I've missed 2 appointments. Any suggestions?
That's tough. I mean, so if you truly can't do an audio visual visit, then the phone consultation is going to be the next best thing. Hopefully they're allowing for that. So you really don't. The only issue with the phone visits only would be if you are on a controlled substance like an Adderall, Ritalin type medication. That gets a little trickier. But I would check with your neurologist's office and see if they can do a phone consultation, because we don't want people falling through the cracks for months and months on end. And I would also just keep in contact with them to find out when are they going to allow for in-person visits. A lot of practices are now opening back up. So for instance, here we've never stopped doing in-person visits. They were somewhat limited in some of our services like physical therapy, but even those are back up and running. And there are ways that those in-person visits can be done safely. So, most practices that are doing in-person visits, we are doing a screening phone call within 24 hours prior to the person's visit, making sure that there's not, some sort of, exposure or anything that would make us suspect that the person has COVID. We are doing temperature checks once you physically get here. All of our staff get temperature checks on a daily basis. And then just so what do we do, for instance, if someone is on a drug like Tysabri, a monthly infusion, and we suspect they may have been exposed, or what if they're having some minor symptoms that would suggest they might have COVID, but we still need to get them in for their infusion. So what a lot of practices are doing in that situation is we have specially designated parking areas. The person comes in, we have a team of nurses that would meet that individual at their car. Those nurses are going to be in full PPE. They give the person with MS full PPE, get them in the building, put them in a secluded area to do their infusion, get them safely back out to their car after the infusion's done, and then wipe that room down, very well, so that everyone stays safe. We are requiring that all of our staff are wearing masks, and when we're in the exam room, we are wearing eye coverings. We're requiring that all people with MS and their caregivers also wear masks. If they don't have one, we give them one as soon as they walk in the door. So check back with that practice and see if at a minimum that they could do a phone call for you.
Okay. All right. Continuing on. Thank you so much for that answer, because it's tough, because some people are afraid to even go.
Yeah.
In person, because they aren't sure of what the standards are, and they want to make sure that they are staying healthy. What about just a quick question about people who might have issues with mobility, and they have a caregiver with them? Does that person stay in the car, or maybe they're used to having people come in with them?
That's a great question. And I would say that for us, and I'm sure it's the same at a lot of MS centers, it's evolving. So there's a balance between trying to keep everyone safe and healthy, but at the same time trying to respect people's comfort levels and their care needs. So we are allowing some caregivers in if there are cognitive issues. So for instance, some people just they're not going to be able to give a good history. They're not going to be able to relay back to their family members what we've said during that visit. So in those situations, we are allowing caregivers to come in. If it's just a need for help with transfers, we're trying to have our nurses and medical assistants and staff take care of that. So we're a rehab hospital. Before we were an MS Institute. So our staff is very used to helping people with who have mobility issues with those things. So it's on a case-by-case basis. Again, we're trying to find that right balance between keeping people with MS and their caregivers happy. We are, if someone is in for a long infusion, for instance, let's say that they're coming in for Ocrevus infusion. Well, that's a 6-hour visit by the time everything is said and done. We prefer that the poor caregiver not have to sit in their car the whole time. So we do have an area that is sort of a nice waiting room up on one of our upper floors that's designated for family members, where they can socially distance. They can have snacks and drinks that are provided for them while they're up there.
And same sort of question, but for the telehealth, are there any issues, HIPAA issues or what have you, that when it comes to having a caregiver participate?
No, not a bit. So that's the same as a doctor's visit. So just like we would have a caregiver there in that doctor's visit, if the person with MS is comfortable with that, whoever that person is, spouse, brother, sister, adult child, whoever it is, that's absolutely fine. I will say, just as an aside, one of the advantages to some of the telehealth visits is we're getting to see inside people's homes, and we learn things sometimes. I've had a few situations where I look around someone's home and we say, wow, there's a lot of stuff in there for someone with a mobility issue, and you worry about just tripping and fall hazards and things like that. And we want to be respectful of people's home environments, but at the same time, we might be able to make suggestions saying, we might want to think about getting PT or OT involved just to talk about home safety and fall prevention, just by maybe improving the home environment.
All right. We have one more question from, this is from Deborah. You said that crossing state lines is legal, but I'm not sure if you mentioned whether most insurance companies pay for telehealth if doctors are out of the area. Usually the doctors have to be in the same network.
So no, that's correct. So what we're talking about are people who are already established, people with MS who are at an MS, like at our MS Institute. So, we primarily see people from Georgia, but we have a lot of people from Florida and North Carolina, South Carolina, Alabama, and the insurance companies have been absolutely fine if we already have an established visit. So we're in that person's network. But that is correct. If you were starting a new visit, and so you're trying to establish telehealth care with someone, and that new doctor is not in your network, that you do need to check with your insurance company on that to see if that's going to be covered. So insurance companies are covering telehealth, but it's telehealth for people who are in your network.
All right. If anyone else has a question, please make sure you just send it via chat or raise your hand. And because we have time for a few more questions. One question I have, are you able to take, and what's the process of new patients coming into the?
So we are accepting new individuals. So here, and not to promote our practice by any means, but if we can be of any help to anyone, we're happy to. So we have 4 MS providers here. So myself, Dr. Cheryl Loring, Dr. Guy Buckle, and then our newest addition, who joined us a year ago, Dr. Jackie Rosenthal. So Dr. Rosenthal did a 2-year MS fellowship at Emory University. And the way those fellowships work is they're primarily at Emory in the VA, but one day of the week they come and work with us here at Shepherd. So we were blessed to be able to get to know her over 2 years, and just knew that she'd be a perfect fit for our patient population. So right now, I would say that in our group, Dr. Rosenthal has the most availability. So we can all see new individuals. If we want to get someone in sooner than later, Dr. Rosenthal's our quickest bet, and she's been just an absolute blessing. People have loved working with her.
Now, when people are new patients, do they have to come into the office first, or do they have to, or can they telehealth?
I would prefer that we see people in person, but it's not an absolute. For instance, just before we jumped on today for our webinar, the new individual I saw was from South Georgia down on the Georgia-Florida line, and we did that remotely just because of the difficulty. So we can do telehealth for the initial visit. Again, if at all possible, I would rather do it in person, but it's not an absolute.
And do you have any don'ts for people who are using telehealth? Anything that they can do before the visit?
Yeah, I would just say treat it as a regular doctor visit. Come prepared with all of your questions, your meds, and whatnot. I mean, the don'ts are probably more on the technical aspect, just trying to shut down stuff, that might be running in the background that might interfere with clicking on that link. Don't get anxious about it. And it's interesting that I'm not the most tech savvy person in the world, so I can appreciate where people might get anxious about a new experience, a new technology. Don't let it worry you. There are so many ways around problems. If we try out a telehealth visit and it doesn't work, we'll figure it out. We'll reschedule it. We'll send a new link. Yeah, don't let it stress you out. I had a lady today who had her first telehealth visit, and she had just worried herself just needlessly about what she was gonna, how was she gonna do it? Is it gonna work out? And it was all fine.
All right. Well, I guess if you have any final words on maybe the future of telehealth, like what do you think might come down the pike,
Yeah.
just to kind of wrap it up?
Like I said, I don't think it's going away anytime soon. And I think we'll see various specialties embracing telehealth, more and more. Um, I would say one of the areas that we are focusing on here at Shepherd Center is on telerehabilitation. So Dr. Debbie Backus is our lead researcher. For anyone listening, if you're not aware, there's a group out there called PCORI, PCORI, Patient-Centered Outcomes Research Initiative. So PCORI is not MS specific. It's for multiple different health issues. So MS, diabetes, hypertension, pediatric issues. And the focus of PCORI is they're saying, we have healthcare providers who might think that this is the direction research should go, but what about people who are the stakeholders, who are the actual individuals living with that condition? What are their priorities for research? And so they bring individuals, in this case, individuals with MS, into these focus groups, and they say, where do you want to see research go? And one of the areas that people with MS identified through PCORI that they wanted to see was telerehabilitation, tele-exercise options. If I can't get into a wellness exercise program at my MS center, what could they do for me remotely? So Dr. Backus received the largest grant that we've ever had at Shepherd Center, a $5 million grant to help coordinate with a few other MS centers, looking at randomizing individuals with MS into either the in-person exercise group or the remote exercise group. After the first wave of this study, we will actually the way the study is set up is individuals will actually select for themselves whether they want to be in the in-person group or the remote group. So we're really trying to see, can we get the same benefits remotely that we do in person? Along the same lines, there are all of these different apps that are being developed, or smart watches that might monitor the number of the quality of sleep. Obviously, we can do steps that people take. So we're trying to incorporate some of those remote technologies into outcomes that we're collecting to really see how people with MS are doing. We're finding that some of the outcomes that people with MS report are sometimes just as good as what we would do in person by tapping on your knees and checking your strength. For instance, one of the oldest measures of disability that we've used in multiple sclerosis for forever is EDSS, Expanded Disability Status Scale. That has been what the FDA accepts as a measure of disability in MS, in clinical MS trials. Well, there are some studies out that have suggested that if we give people with MS a questionnaire and have them calculate their EDSS on their own, that it's almost as accurate as us doing it, in person. So I think there may be some silver linings to the challenges we're facing with the COVID pandemic. Maybe it forces us to think about new and more efficient ways of managing MS, and hopefully those things will stick around after the COVID pandemic is over.
Okay. Well, and I guess the final question is really comes to privacy. People have concerns of, I mean, I've just, my partner's mother-in-law is a doctor, and she gets questions all the time. Are you recording this? How is it being? And those sorts of things, people are kind of concerned about that.
No, so what you want to see is that your healthcare provider is using one of the the commercial platforms where there is privacy guaranteed. So for instance, you wouldn't want to just jump on a FaceTime visit, for fear that maybe that's not a secure way of doing that. So for instance, we use one called ExamMed that's based here in Atlanta. That is encrypted information. People are not going to hack into that information. We're not recording any of that information. For I can't think of any reason why you would. Maybe in a physical therapy visit if you were just trying to record someone's gait, but I don't actually know if we have that capability, but I know from our standpoint, that is not something we're doing. So it really, is a standard doctor visit or healthcare provider visit. We make sure on our end that we are in a private room. We have a notice on our door that says, that telehealth is in progress, so that no one's knocking on our door, that no one's calling us, that our cell phone's not going off. We're telling our staff, and this should be true for any healthcare provider, treat that as an exam room. Treat that there is a person in that exam room who expects privacy. Don't be popping in, just treat it the same way you would a real doctor visit.
All right. Well, Dr. Thrower, thank you so much for all the information that you've given us. If anyone missed any part of this conference, it will be replayed on msfocusradio.org and available on demand on our MS Focus SoundCloud page or our YouTube page. And just search for the Multiple Sclerosis Foundation. And remember to follow MS Focus on Facebook, Twitter, and Instagram for times and access information. The next teleconference we will have is Thursday, September 17th at 2:30 p.m. Eastern Standard Time with the topic to watch your step, fall prevention, and MS. Our sincere thanks to all the attendees for participating, and especially to you, Dr. Thrower. It's always great to see you. And thank you so much for your time. And if you have any final words.
No, thank you, everyone. I appreciate people tuning in. Stay safe. I think we're all looking forward to more normal times when, the telehealth is great, but maybe there'll be a day when we need a little bit less of it.
All right. Thank you so much.
Thank you. You guys take care. Thanks.